Hi, I'm Kenn Haring, and I'm a volunteer with North Carolina's SHIIP program. SHIIP stands for the Seniors Health Insurance Information Program. It's a program of the Department of Insurance for the state, and its objective is to help Medicare beneficiaries get objective and accurate information to help them make their Medicare choices. I've been with the program for the past 2 years, and our coordinator of volunteers for SHIIP here in Buncombe County is Nathan Johnson. Nathan?
Hey, thanks, Ken. I've also been with the Council on Aging and the SHIIP program for 3 years, and I hear a lot of questions about Medicare, and it reminds me of juggling. Part A, Part B, Part C, Part D. That's a lot of information to try to understand and figure out how it all works together. Today, we're going to show you an example of what a Medicare counseling session would look like.
Hello, Shar. My name is Sybil French, and I'm going to be answering your Medicare inquiries. It's my understanding you have some questions about your dad.
Yes, I do, Sybil. He's 85 and he's had Medicare for some time, but actually I think I would like to know more about what Medicare is so that I can help take care of him since he's kind of losing it a little bit.
Well, I'll give you a general overview.
Okay.
Medicare has two parts, A and B. Part A is sometimes referred to as hospital insurance because it pays for hospital inpatient expenses. It also pays some skilled nursing care. It will cover home health care in certain cases and end-of-life care. Now, Part B, sometimes called medical insurance, generally covers outpatient services, including doctor visits, durable medical equipment, outpatient surgery, things of that sort, and some health care. If you are in a Medicare private health plan, your plan must provide all of the services covered under Parts A and B, but can do so with different rules and costs.
Well, so what exactly does Medicare pay for?
Medicare pays for inpatient hospital care, short-term nursing care, home health care, hospice care, outpatient care, diabetic and medical equipment. There are, however, some things that Medicare does not cover.
You're telling me that Medicare doesn't cover everything? Well, what don't they cover?
Medicare does not pay for general dental, vision, or hearing services, annual routine physicals, respite care, most chiropractic and podiatry care. It does not pay for alternative treatments such as acupuncture and so on.
Well, what does all that cost, and will they be going up in the future?
Costs for Medicare are tied to the cost of living and could go up every year. Your monthly premium for Medicare Part B is $96.50. It could be, for some people, $110.50. The hospital deductible is $1,100 per 60-day benefit period. The doctor deductible is $155 annually. The coinsurance, the part that you have to pay, is 20% of Medicare approved doctor and medical charges. Sometimes is an excess charge. If a doctor does not accept Medicare assignment, he can charge 15% more than what Medicare reimburses. He can charge you 15% more.
That sounds like a lot of things that aren't covered. Well, is there anything I can do about that? Any other plans, or is there anything I should know about covering those costs?
In North Carolina, there are other policies called supplement plans or Medigap plans that can help quite a bit in covering those costs. Some of them are expensive, some of them not so expensive, but they can be very helpful. Supplements may pay for the hospital and doctor deductibles, doctor visits, tests and x-rays, rehabilitation costs, diabetic and other medical equipment. Medicare supplements or Medigap policies are one option to help fill in the gaps of original Medicare. Supplements range from covering all Medicare costs to just covering hospital deductibles. But ask yourself, how much coverage do you need and how much can you really afford?
I've heard that there are plans where you don't have to pay any premium. What are those?
These are called Advantage plans or Medicare private health plans. Medicare Advantage plans are private health insurance plans that provide Medicare benefits. Medicare Advantage plans ask all of your doctors and hospitals if they take it. If the doctor doesn't take the plan, it's useless to you. Plans change every year, and you can change your plan as well. Be aware of the out-of-pocket costs with these plans. Medicare Advantage does not pay for long-term care, as in nursing home, co-pays at hospitals, doctor's visits, pharmacies, and medical equipment suppliers. If you have an Advantage plan, it means you no longer have a Part A and B plan, and it's important for you to realize that. So you can't use your Medicare card any longer at the doctor's office to pay your bill. You just put it up on the shelf, unless you have to call 1-800-MEDICARE for something, and then they need to have your Medicare number. But when dealing with your doctor, make sure you just use your Advantage plan card. With some of the Medicare Advantage plans, you do pay a premium, an added premium, but you're correct, in many of them you don't. If you are on Medicaid, you probably do not need a Medicare Advantage plan.
Well, now, what about the Medicare prescription drug benefit? I'm going to be 65 soon, and what are those benefits, and are they separate from the Medicare Advantage plan, and should I enroll in one of those?
Yes, Medicare has prescription drug coverage plans. They are available through private companies. If you have original Medicare, choose a PDP, a prescription drug plan. If you have an Advantage plan, you usually get it as part of the plan, but you don't have to. You can purchase a prescription drug plan, what they call a standalone plan, or you can purchase it as linked to an Advantage plan. Each plan has its own list of covered medications, and generally the plans will only pay for the medications in their formulary. Whether you should enroll in a plan depends on whether you currently have prescription drug coverage. It depends on your income and how much you currently spend on medications. If you have coverage at least as good as or better than Medicare's basic benefit and you like it, you don't need to get a prescription drug plan. You just keep what you have. Check with your employer to see if your present plan works with Medicare Part D. Some don't. If you have no drug coverage or drug coverage that's not as good as Medicare's, consider choosing a plan. If you have high drug costs, you may save money. If you have low drug costs, having a drug coverage could cost you more now, but protect you from high costs in the future. And if you don't have creditable coverage and don't enroll in a drug plan, but choose to enroll in it later, you may have to pay a penalty. In fact, you probably will have to pay a penalty.
Sybil, you mentioned creditable coverage. What exactly is that?
Some examples of creditable coverage are an employer group health plan. Some people have that. VA benefits, TRICARE, federal employee health benefits, North Carolina employee benefits are also considered creditable coverage. And if you have that coverage, you don't need to enroll in a prescription Part D plan.
I see. But now I have a question about that donut hole that everyone talks about, and I don't really not sure how that works.
If your Part D plan has a deductible, you are going to have to pay the full retail price under your plan until the deductible is met. After meeting your deductible for the first year, you will usually pay a copay. That is about 25% of the cost of your medication, of the retail cost of your medication. Now, when the retail cost of your medication reaches $2,830.01, you will fall into what they call the gap or the donut hole. When you're paying your copay for the medication is totaling the retail cost that they have assigned for the medication. You'll no longer be paying the less expensive copay. When your out-of-pocket reaches $4,550, you will go into another category called the catastrophic category. Then your copay will drop considerably, and you will be paying approximately 5% for your medication. Most people do not go into the donut hole, but some do, and it can be very expensive. And some ways of staying out of it are having and requesting that your doctor prescribe, if possible, generic medications, or if they're going to prescribe name brand medications, at least they could try to stick to the least expensive ones. Also, if you purchase, and most plans have an option to purchase the medication through mail order. If you do it with this option, mail order is usually cheaper.
That's good to
You
know
stay
as
out
well.
of the donut hole. Some things that the Part D plan does not pay for. They don't pay for anti-anxiety drugs, over-the-counter medications, vitamins, cough syrup, eardrops, aspirin, anything that you could get over the counter.
I see.
Diabetic supplies covered by Medicare, outpatient benefits. Also, it's important to realize that there is help available, financial assistance available for some people who are really in need of financial assistance. It's called Low Income Subsidy, or LIS. It has to be applied for through the Social Security Administration. Some criteria for that this year: if you're a single person, the monthly income criteria is $1,517. If you're married, it's $2,042. If you want to apply for that, there are several ways, but we suggest the quickest way would be to contact the Council on Aging of Buncombe County at 277-8288.
I have another issue, a concern. Another person in my family has a very low income and doesn't get very much Social Security. And I was wondering, because she does have such a low income, is there a possibility about her getting Medicaid?
It's possible that she could get help from Medicaid, depending on just how much Social Security that she gets each month. Micky Corn from the Department of Social Services just made a video concerning that.
There are two Medicaid programs I would like to share with you. The first coordinates with Medicare and helps to supplement Medicare expenses. It is called the Qualified Medicare Beneficiaries Program, or MQB. MQB has two levels of benefits. The first level pays all of the Medicare premiums, co-pays, and deductibles. The second level pays only the monthly Part B premium, which covers doctor visits and test costs. There are income and resource limits for the MQB program. Accountable monthly income limits for the level that pays only the Part B monthly premium, which covers doctor visits and tests, is $1,219 for a single individual and $1,640 for a married couple. The resource limits for both MQB levels are currently $6,600 for an individual and $9,910 for a married couple. These limits are a net amount, which means they exclude specific items like your home, a car, and personal property. One application with the Department of Social Services will be evaluated for an individual or couple's greatest benefit. The second Medicaid program pays for nursing home care, or what we call long-term care. Remember that Medicare only fully pays for long-term care for the first 20 days after an individual is discharged from a hospital. The Medicaid long-term care program supplements an individual's income to pay for the full cost while in a nursing facility. Currently, Medicaid is paying for almost 60% of all long-term care provided in Buncombe County. Like the MQB program, there are income and resource limits. For long-term care, the income limit is higher than the MQB programs. The resource limit is $2,000 for a single individual. For details on the long-term care program, it is best to talk with a caseworker at the Buncombe County Department of Social Services. You can apply for all of the Medicaid programs in one of two ways. Applications can be made in person at the Buncombe County Department of Social Services on any business day, or a mail-in application can be requested by calling 250-5500.
Sure. We talked about a lot today, and sometimes Medicare can be very confusing and complicated. Do you have any questions?
Actually, I don't, Sybil. You've given me a lot of help with the questions I had, and I know that I can come to you at the Council on Aging at any time. I appreciate your help, and it was very nice to meet you. Thank you very much.
You're quite welcome.
That's a lot of information. I'm glad you stayed with us because we have one more important topic to cover, and that is how you protect yourself. Recently, the White House Office of the Press Secretary issued a statement that said, each year billions of American taxpayer dollars are wasted on improper payments to individuals and organizations and contractors. And these are payments made in the wrong amounts, to the wrong person, or for the wrong reason. In 2009, improper payments totaled $98 billion, with $54 billion of those dollars stemming from Medicare and Medicaid. That costs each of us and all of us. In our county, we have SHIIP counselors specially trained to educate and to assist Medicare and Medicaid beneficiaries to protect, detect, and report improper payments. After all, each of us is the first to know when an improper payment has been made, because it'll show up on our statement from Medicare or from our private insurance company. All of us depend on each of us catching these mistakes or these improper payments. The first thing that you can do is protect your Medicare number. Treat your Medicare, Medicaid, and Social Security numbers just like a credit card number. Never give these numbers to a stranger. And don't carry your Medicare or Medicaid card unless you will need it. Only take it to doctor's appointments, visits to your hospital or clinic, or trips to the pharmacy.
Beware. Do not be influenced by advertising for services, equipment, or medications. Medicare does not call or visit your home to sell you anything. Rarely are Medicare services free.
Keep a record of your doctor visits, your tests, and your procedures. You can either do that in a personal journal or a file of receipts, or if you have internet access, you can even see what Medicare pays as the claims are processed. It was just a few weeks ago that I helped somebody enroll in Medicare, and they called me to tell me that they'd found a payment for a procedure that he didn't have by a doctor in California that he'd never seen.
Report Medicare, Medicaid errors, fraud, abuse, and scams to the North Carolina SMP program at 1-800-443-9354.
You will protect other people from becoming victims, and you'll help save your Medicare benefits.
You can also find more information at coabc.org or the Council on Aging of Buncombe County. Phone number 277-8288. Thanks for joining us today. We hope that the information has been helpful and that you can keep all the balls in the air, because sometimes it can be pretty challenging.